Hello friends, today we will discuss about the pathological examination of urine, sputum, blood and stool. Remember, microbiological and virological laboratory testing has a key role in the management of patient with infection. Accurate and rapid identification of significant microorganisms is vital for guiding optimal antimicrobial therapy and improving outcome from infectious disease. Laboratory diagnosis is also essential for effective infection control in both the hospital and community settings, as well as providing invaluable epidemiological data. Clinicians, including nurses, doctors, and professionals allied to medicine, have responsibilities for the collection and safe transport of samples to the laboratory. The validity of test results largely depends on good practice in the pre-test stage, and it is essential that documentation is accurate and comprehensive. Microbiological tests are not as standardized as some other laboratory tests. The ways in which a sample is processed and the results are interpreted depend heavily on the information provided with the specimen. Contamination of samples, especially those from normally sterile sites such as blood or cerebrospinal fluids, leads to misleading results, inappropriate antibiotic usage, and unnecessary laboratory work. Prolonged periods of storage at ambient temperature and delay in transport of specimens to the laboratory may increase the number of contaminants present. It is therefore essential that every effort should be made to avoid these problems. Pathological examination of urine. Most urine samples sent to the microbiology laboratory are for bacteriological investigation. The same collection techniques also apply to samples sent for virological investigation. Urine samples should be dispatched to the laboratory as soon as possible, or no more than 4 hours if kept at room temperature, or up to 24 hours if kept at 4 degrees centigrade to avoid overgrowth of organisms and misleading results. All methods used to collect urine samples can result in contamination with bacteria from outside the bladder. This can lead to an inaccurate diagnosis, involve unnecessary treatment, or require a sample to be repeated, which has implications for patient's care and cost effectiveness. Normal social hygiene, such as washing the genitalia with soap and water and drying thoroughly, is considered sufficient to minimize contamination from the skin prior to collection of the specimen. Assess the clinical and psychosocial needs of the patient as to whether cleaning the genitalia is necessary. The nurse must be sensitive to the cultural issues surrounding touching intimate parts of the body. It can be difficult to obtain a urine sample from incontinent or non-toilet trained children, and the method used for specimen collection are midstream or clean catch, specimen pad or bag specimen, suprapubic aspirate, catheter specimen, obtaining urine from a Mitrophane of stoma. Precautions. Ensure that the child's or young person's genitalia have been washed with soap and water and dried thoroughly. Ask the child or a younger person to wash hands with soap and water. Ask the child or a young person to void a small amount of urine into the toilet first. Then ask the child or a young person to urinate 10 to 20 ml directly into the specimen container. In the female, encourage separation of the labia while passing urine. In the male, Encourage retraction of the prepuce if appropriate while passing urine. Instruct the child or a young person that the remaining urine can pass into the toilet. Place the lid securely on the specimen container. Wipe the outside of the container with a sanitizing wipe and place container in polythene transport bag. Method for pathological examination of urine. A sample of well mixed urine, usually 10 to 15 ml, is centrifuged in a test tube at relatively low speed of about 3000 rpm for 5 to 10 minutes until a moderately cohesive button is produced at the bottom of the test tube. The supernatant is decanted and a volume of 0.2 to 0.5 ml is left inside the tube. The sediment is resuspended in the remaining supernatant by flicking the bottom of the tube several times. A drop of resuspended sediment is poured onto a glass slide. Stain it with a suitable stain. And observe under microscope. Pathological examination under microscope. For a bacteria, normally absent. If present, may indicate infection. For yeast cells, normally absent, may be present in acidic urine containing sugar. For parasites, normally absent. If present, they may be Trichomonas vaginalis from vagina or Trichomonas hominis from rectum. Pathological examination of sputum. Good quality of sputum samples are essential for accurate microbiological diagnosis of pneumonia, but also acute tracheitis and bronchitis. Samples contaminated with oropharyngeal secretions and saliva are difficult to interpret and can be mislead. Encouraging the child to cough, especially after sleep, and expectorate into a container. Alternatively, a poorer sample may be obtained as from nasopharyngeal or tracheal suction. Using a sputum trap can be undertaken. Physiotherapy may help to facilitate expectoration. Ensure the material obtained is sputum and not saliva. Direct pathological examination by physical appearance of sputum. If found bloody, that is, hemoptized, the possible infection would be pulmonary tuberculosis, lung abscess, bronchitis, mitral stenosis, or pulmonary infection. If found rusty, possible infection would be pneumococcal or lobar pneumonia. If found red, currant jelly like, then the possible infection would be Klebsiella. If found greenish in color, then the possible infection would be of Pseudomonas. If found purulent, then the possible infection would be pneumonia or a lung abscess. Microscopic examination of sputum. An adequate amount of sputum sample is collected in a test tube. A drop of it is poured onto a glass slide. Stain it with a Gram's stain observe under microscope. If gram-positive observed, it may be Staphylococcus cause epidermitis, Streptococcus viridans cause pneumonia, diphtheroids, Enterococci, Micrococci, Lactobacilli, and yeast, that is Candida. If gram-negative observed, it may be Neisseria, influenza, Fusobacterium, coliforms, and Mycobacterium catarrhalis. Examination of acid-fast bacteria is done with Zell-Nelson staining. Other techniques include the use of fluorescent microscopy, culture on conventional media, commercial automated culture methods, and molecular methods includes polymerase chain reaction. Pathological examination of blood. Blood sampling should be performed by a healthcare worker trained and competent in the procedure. As there are many hematological, biochemical, immunological, and microbiological blood tests, the person should seek information as to the appropriate laboratory containers required for specific tests and the amount of blood required. Procedure for bacterial examination. Take a blood fluid on a slide and make a smear. Dry and stain with Kram's stain. Observe the gram-negative and gram-positive bacteria. Under normal condition, gram-negative bacteria are the dominant. In the rumen, the large streptococci are predominantly present. Under acidosis condition, gram-positive bacteria are predominantly present. Procedure for protozoal examination. Take 1 or 2 drops of blood and make a smear on the slide. And stain it preferably. Cover it with cover slip. Observe under microscope. Grade the number of protozoa. Record the result as follows. If it is abundant, record the result in terms of 3 positive signs. If it is moderate, record the result in terms of 2 positive signs. If it is few, record the result in only 1 positive sign. If no protozoa, record negative result. Pathological examination of stool. Please specify whether the sample is a routine, that is screening sample, or an investigation for suspected intestinal infection. If viral gastroenteritis, for example, norovirus, rotavirus, if it is suspected, the stool specimen should be sent to the virology laboratory. To exclude a bacterial cause, a second stool specimen can be sent to the microbiology laboratory. A fecal specimen is more suitable than a rectal swab. Examine the sample for consistency, odor, or blood and record observations to monitor changes. If segments of tapeworm are seen, send to the laboratory. Tapeworm segments can vary from the size of rice grains to a ribbon shape, 1 inch long. For the identification of Enterobius vermicularis, that is threadworm or a pinworm, material should be obtained first thing in the morning on awakening by using a clear adhesive tape, for example sellotape on a slide. Place the sticky side of a strip of a tape over the anal region to obtain the material and stick the tape smoothly on a glass slide. The worm can then be identified under the microscope. Record the result. Threadworm lay their ova on the perianal skin at night and therefore will not be seen in a fecal specimen. Where acute amoebic dysentery is suspected, the specimen of stool must be freshly dispatched to the laboratory. The parasite causing amoebic dysentery exists in a free-living motile form and in the form of non-motile cysts. Both forms are characteristic in their fresh state, but the motile form cannot be identified when dead. Summary. Friends, now it's a time to summarize of what we have learned today. We have discussed the techniques and also observed the pathological aspects of human body sample, including urine, sputum, blood and stool. This laboratory testing could thus be beneficial in the management of patient with infection. Accurate and rapid identification of significant microorganisms is vital for guiding optimal antimicrobial therapy and improving outcome from infectious disease, so an effective infection control in both the hospital and community settings, as well as providing invaluable epidemiological data, could be assessed further, and finally, if proper detection, there would be successful cure and consequently healthy disease-free life. Thanks.